Good morning, good morning, good morning. Just wanted to go ahead and get this video out in regards to the rest of chapter 31 for the respiratory unit. Again, this information is information that I said that I would get out to you all and just to finish up the chapter. So it was at the end of chapter 31 where we were kind of looking at where respiratory failure was on the outline. And I did mention as far as what that would look like for this test. But just wanted to go ahead and get this information out. When we look at respiratory failure, we think of something's going on where their respirations or the respiratory status is not functioning like it should and is causing a decline in what's going on with their respiratory system. So what it is basically it's diagnosed when the patient is not able to maintain adequate blood gas values. And a lot of times that happens because of hypoxemia. That means that they're not moving air. They're not breathing in or out well enough for air to move. Or it could happen because of poor oxygenation. That they can breathe, but it's not the oxygen is not getting in their blood like it needs to. And so, or it could be both. So there's a problem with their breathing in and out, or if they're breathing in and out good, then that blood that contains the oxygen is not getting to the areas that it needs to in order to allow for breathing to be effective. So when we look at the cause of it, it typically is called for somebody that has chronic obstructive disease, and we kind of talked about COPD, or we talked about obstructive disorders and disease that could happen. But that's generally the cause for acute respiratory failure. There are different other causes that can happen, and they're basically in regards to CNS, the central nervous system. So when we look at things that can affect breathing, such as somebody that has a CNS disorder like stroke, spinal cord injury, myasthenia gravis, inhalation of toxic substances, opioid overdose, and aspiration. Those are also causes of acute respiratory failure. If you think of stroke, you think of somebody who may have left-sided weakness and they're not able to breathe effectively. And so what happens is that could cause for them to have some failure going on when we're talking about respirations. How do we prevent acute respiratory failure? It's making sure that we're trying to prevent it by avoiding any type of a respiratory issue. That's how we can avoid a lot of the respiratory disorders, is making sure that we're telling them, hey, practice your coughing and deep breathing. We're telling them to make sure that they're letting the healthcare provider know if they're having some purulent drainage. Of course, purulent drainage means there's pus involved in it. But making sure that we're communicating effectively with our healthcare providers. And also those persons that may use sedative and narcotics, making sure to use those cautiously, especially our older people. And then even with hospice, a lot of times they'll be on different meds that kind of are sedative and kind of help. But just being careful of those sedative, especially if they have chronic respiratory issues anyway. So when we look at signs and symptoms, a lot of times when somebody cannot breathe, and that's with a lot of them, they'll get restless, they'll get agitated, they'll be confused. They may even be sleeping. So what do we want to do? We want to look and see what their oxygen level is so we can obtain ABGs, arterial blood gases, to see what it is. And a lot of times these patients can have respiratory acidosis. You all kind of talked about that in chapter 6 when you went over chapter 6. The patient is cyanotic and dyspneic. They're having difficulty breathing and they're turning blue. So their respirations can become more rapid and deep. when we look at what can we do to help this person that's in acute respiratory failure, then we want to make sure that we're assessing them properly, observing the patient, reporting those findings to the healthcare provider. They may need to be started on oxygen via nasal cannula or even a mask. Remember that certain masks deliver different concentrations. You got your simple, you got your non-rebreather, you got your Ventura, making sure to know what each mask is responsible for. Where one mask, it's allowing the oxygen concentration to be a certain percent. Some of it has to be within a precise, like very accurate and detailed. But another therapeutic measure we can do is making sure we have those antidotes. If a person is in respiratory failure because they've overdosed on a sedative or a narcotic, we would utilize Narcan to give them for that. If there's an underlying bacterial infection, of course, we want to be able to make sure that they're on antibiotics. And then bronchodilators, which help open them up and provide ventilation. Making sure that they can use those. If they need to be suctioned, that's another way we can properly care for somebody that has respiratory failure. Another disorder that's mentioned that, was not particularly on the outline, but just ARDS. You hear that, you hear SARS, and you hear ARDS, which is acute respiratory distress syndrome, also known as an acute lung injury. It's just a group of disorders where there's some type of injury that's causing different respiratory issues. And so what we want to make sure is that we're monitoring them, we're assessing them, we're helping them to prevent it by treating underlying disorders. They may have dyspnea, tachypnea, cyanosis that may happen with this. And so we want to make sure that this person is cared for in the ICU, that you constantly have eyes on them to make sure that it does not go into the acute respiratory failure. It may be supportive. They may be on diuretics to help get that fluid, if fluid is the cause, and things like that. Lung cancer is one of the leading causes of cancer disease in the United States. A lot of that happens because of smoking. Tobacco is telling them, hey, you got to stop smoking. The number one way to prevent it, stop smoking. We want to make sure that this person gets the care that they need as far as with the diagnosis of lung cancer. Making sure that if it's chemo or radiation or whatever is needed, that they're able to get the care that they need. They may need a lobectomy at different stages to lung cancer as well. But just, basically knowing that cancer is something that can happen in the lung, just like it can happen in any of the other systems. And then there are different surgeries that can be done on the lung that it goes over. If somebody has a pneumonectomy, that's just removal of a lung. Lobectomy, which is a removal of one of the lobes of the lung. And then just making sure that there's also something known as the lung transplantation that can occur to help these patients with what's going on with them respiratory wise. Also making sure that you all are just familiar with the different things. Just refer back to COPD and realizing COPD is an umbrella of disorders as well, where you have your chronic bronchitis, your asthma, as well as the emphysema, and knowing the difference in those. But that's summarizing the rest of 31. Definitely reach out if you have any additional questions. We really didn't talk about the restrictive disorders. We did in a sense, but knowing that restrictive disorders and obstructive disorders are different as it relates to respiratory. Definitely reach out with any questions, concerns. Hope that you all have a great weekend, and here if you need anything.